all of these people, all these consumers, lose out because of a lack of competition.
A class action lawsuit claims everyone in Western North Carolina is paying more for health care because of Mission.
And this evening, News 13 continues its investigation, digging into the prices presented in the suit.
News 13's Karen Zakalak is also comparing the cost to other local hospitals.
And the total billing for the month of February was $1,383.
It's been several years since Noreen Rutledge got an ulcer on her ankle, but she hasn't forgotten the experience or the bills that came afterwards.
So you kept up with all of the payments and all of the charges?
Yeah. Rutledge was surprised when she noticed the charges nearly tripled in early 2019, right after Mission's sale to HCA was finalized.
How does it feel as a patient to get these higher bills for the same treatment?
Well, it makes me afraid to get sick. I felt that it was extortion.
She says she called Mission a dozen times for an explanation and even wrote to the Attorney General's office.
The prospect of having to go into that hospital and not knowing what kind of poverty you're going to come out with, there's no transparency.
She's not alone. This complaint to the Attorney General says a patient was charged nearly $40,000 for a hysterectomy, saying the charges for Mission Health far exceed what is reasonable, according to Healthcare Blue Book, which showed a fair price of around $14,000. Mission Health couldn't comment on Rutledge's case, but sent us a statement saying, in part, our billing department works hard to ensure a patient-friendly process and prioritizes responding to and correcting issues in a timely manner. The idea that patients are being charged more for health care because of Mission's monopoly is the main allegation in the lawsuit against the hospital. Antitrust expert and Duke Law professor Barack Richmond says for the first time, the lawsuit is revealing exact prices for Mission procedures.
These prices have been hidden for decades, and only now are we starting to realize, those who are paying more are starting to realize that they're paying more than others.
In the lawsuit, this chart shows a knee replacement is more than $5,000 more at Mission than other hospitals in the state. And in 2020, a shoulder surgery cost nearly 3 times more at Mission. According to the lawsuit, a C-section at Mission is more than $10,000 compared to the state average of just over $4,000.
Twice as much? That's alarming. That's not a reflection of a market working well.
How alarming is it, the numbers that are presented in the lawsuit?
It's certainly disconcerting. You don't want to do that. You feel like you're being cheated.
A spokesperson for Mission Health says the hospital can't comment on the pending lawsuit. But we wanted to do our own price check and went to our local hospital's cost estimators tools online. Some facilities, like Advent Health, only showed certain procedures, and some, like Pardee, were easier to navigate than others. So comparing costs was difficult. But here's what we were able to find. A cardiac stress test tracing was more at Mission. A new patient visit was slightly less at Mission. And a mammogram cost the most at Pardee. But we couldn't find prices online for many of the procedures listed in the lawsuit. Richmond says the higher prices go beyond the hospital visits and stretch to every single person with health insurance in our area.
Whether you use Mission or not, if you have insurance in Western North Carolina, you're paying monopoly prices, and it's cutting into your paycheck.
He says that's because hospitals negotiate annual insurance premiums with providers like Blue Cross. You may remember in 2017 when a fight over rates left Blue Cross patients out of network with Mission for 2 months. The lawsuit claims that since Mission has 90% of the market share, the hospital is able to contract excessive prices being billed directly and indirectly to people across Western North Carolina.
Those really high prices that Blue Cross pays for its subscribers to the monopolist are paid through insurance premiums, annual insurance premiums that every working person who has insurance, and frankly, everybody who just purchases insurance, either through their employer or otherwise, they're all paying those prices.
For Richmond, regardless of what happens with the lawsuit, patients should be aware of healthcare costs and ready to make smart choices.
In Western North Carolina and in the country, we've got to figure out ways to deal with monopolies. Monopolies are here for good. It's very hard to break these things up. It's very hard to start a new hospital. We're going to have to be really creative.
Yancey County is the only school system in our area that has not mandated masks for the school year.
Now, 1 month into the school year, some are concerned about school safety and ongoing quarantines.
News 13's Andrew James talked with concerned parents in Yancey County.
Political games. That's what one Yancey County parent has to say about the school system's lack of a mask mandate. He's worried about his son's safety, and he's asking the school board to make some changes. Caleb Yarborough tells me he worries school isn't safe for his son Josiah. He fears politics are getting in the way of good decision-making by the school board.
And many children, including him, and many parents, including myself, have immune problems, and COVID would wreak havoc.
Josiah has an immune system deficiency and is not yet old enough to be vaccinated. His dad now starting an online petition asking the school board to offer virtual learning for families that do not feel safe without a mask mandate. After my calls and emails went unanswered, I went to the Yancey County school offices Thursday for more information about COVID cases in schools. What would you say would be the best way to get some type of information? I mean, no one was available to comment, but we found this on the school system's dashboard online. As of September 15th, there are 42 active cases in the school system, leading to 289 quarantines.
So far, it's been a train wreck. The school system has ignored the public, other parents who wish for masks, parents who wish for virtual learning. We have been ignored completely.
In just a month, Yarborough tells me his son has already been quarantined twice. Both times he tested negative. How long have those quarantines lasted?
It's anywhere from 3 days, we get the test results back, up to a week.
It's very hard for kids to make up something like that.
After 30 years teaching in Yancey County, Elizabeth Bolter retired last October. She too thinks masks should be mandated, even writing letters to the school board about her concern and the concerns she hears from friends who are still teaching.
It's spreading a lot. There are lots of kids in quarantine, lots of teachers. There's teachers out with the virus.
Now, it's important to note that I've called and left voicemails for the superintendent multiple times this week. I've also emailed every school board member asking for comment on this. So far, I have not gotten any response.
Fewer ambulances on the road and longer response times in some rural areas.
And those are some of the issues Henderson County Emergency Services is dealing with amid a staffing shortage. News 13's Anjali Patel shows us the help that's on the way.
Over the past 4 months, Henderson County EMS has had to take an ambulance off the road 87 times due to a staffing shortage. They're hoping 7 new positions will ensure they can keep all trucks on the road in the future.
As cases rise again, it's taking a toll on those who are first on the scene of a suspected COVID call.
It just increases that kind of base level of stress that our staff are feeling every day. And that's why fewer folks are willing to work as many overtime shifts. They need a mental and physical break from things.
Henderson County EMS often relies on overtime to keep its ambulances staffed, but that hasn't been guaranteed lately with fatigue setting in and quarantines.
We have seen some changes in response times. Fortunately, they've not been in the busier areas.
High turnover also compounding the problem. They've only got 1 vacancy right now, but since 2018, 24 employees have left.
I like to call it an ebb and flow of staffing. Folks are looking for another job, maybe that pays more. We have a number of staff that decide they want to go back to school and further their education, maybe become a PA or a nurse.
Those concerns leading county commissioners to approve the addition of 2 vacation or sick relief positions and 5 full-time positions. It'll cost the county about $455,000 in American Rescue Plan funding.
Seeing how hard it is for a lot of employers to attract employees right now and seeing that there's such high turnover, why add the 7 new positions? How are you going to work to recruit to fill those?
Well, we're very fortunate. Our county manager, working under the direction of the Board of Commissioners, has charged our Human Resources Department to do a comprehensive salary study. They're looking at that to see where we are in the region, both in the public and private sector, to see if there's an area we can improve.
He says these new positions are an investment that he believes will pay dividends to the community and his staff.
Now, over in Buncombe County, the EMS director says they currently have 4 full-time and 8 temporary positions open. He says they're actively recruiting and always working to bring in more staff.